Hi. Okay, we're live. Yeah, we're on. We're a little late. Technical difficulties, but here we are.
Hi, everybody.
All right, so thank you so much for joining us. Today we are talking about thyroid function, specifically hypothyroid. But before we dive into that, we've got some housekeeping things to tell you about.
Yeah, so we're about to launch our new website. We'll have a new clinic name very soon. It will be the Poppy Clinic. The website will be ready in the next week or two. So we're going to go forward and launch all the social media just to get content going, but also to help direct you guys to where to find us, because come the new year, we're going to do all of our Facebook Lives over there on our Facebook page. The Instagram page is up as well. So we will post all that after. If you guys would follow us, we would absolutely love that. You will find very valuable information about everything happening in the clinic and the community space. So
that's the Poppy Clinic, like Dr. Michelle said. In the new year, we're going to be broadcasting all of our Facebook Lives from that Facebook page. So we'll post the link when we're done. Head on over, give it a thumbs up, share with your friends.
We would really appreciate that.
All right, so today's topic is hypothyroidism. This is a huge topic and obviously can get a little complicated. So our goal today is to try to provide you with some bite-sized pieces that, will just kind of educate you a little bit more and empower you to, have some more tools and resources to assess your thyroid function and kind of, nurture your thyroid health.
Yeah, what we're going to try and do is inspire and empower without the overwhelm. So we're going to keep it brief, but very informative. So if you want to write any of this down, please feel free to do that.
Yes. Okay, so why is this an important topic? Well, it is a huge topic, but also I think we both think that it's something that is often under-evaluated and underdiagnosed. So the thyroid has such a huge impact on our entire body and all of our processes. And even subtle dysfunction in the thyroid can leave us feeling really unwell. So kind of talking about it and bringing it to awareness is really important.
Yeah, and I think too, just remembering that, we do have reference ranges in our blood work, and that's often what's being assessed, but naturopathic doctors are always looking for optimal health. So really knowing numbers, what to ask for, what to look for to ensure that not only are you free from disease, but that you're in optimal health. And I think that's why the thyroid issue and hypothyroidism is such a big topic, because a lot of people have symptoms of hypothyroidism, but they don't meet the clinical needs in terms of blood work to make a diagnosis. And so they're suffering, and yet there's not a lot of support for them.
Yeah. And we see that all the time. All the time.
Absolutely. So what is hypothyroidism? Clinical hypothyroidism is actually being out of the TSH reference range. If that's your thyroid stimulating hormone, which most conventional doctors will run for you. In our opinion, there's also other avenues to explore to understand when it comes to hypothyroidism. So if an individual exhibits low thyroid symptoms, their blood work is suboptimal, then we will look at it from a subclinical hypothyroidism perspective. There's also Wilson's temperature syndrome. And those individuals may have all the symptoms or many of the symptoms of low thyroid function, have perfect blood work and appearance, but their body temperature is low. And Dr. Wilson has made a very strong correlation with low body temperature and low metabolic function. And so that can often be clinical reasoning enough to address or treat a thyroid or treat the individual with low thyroid function.
Yeah, and treat it, like we're always... It's preventative medicine, right? We don't take that let's wait and watch approach. If we see a list of symptoms and even a slight indication in lab work and we really, we see that it's impacting your health, then we're going to give you the tools and resources to support that thyroid function so that you can feel better.
Absolutely. So some of the symptoms you might be experiencing are fatigue, fibromyalgia or pain, depression, weight gain, infertility, migraines, PMS, irritability, fluid retention, hair loss, dry skin, dry hair, insomnia, anxiety, panic attacks, irritable bowel syndrome, asthma, allergies, irregular periods, decreased memory or concentration, muscle and joint aches, low sex drive, carpal tunnel syndrome, and hives. And most of my female patients exhibit these symptoms to some degree, which is why I think we do so much thyroid testing and assessment and discussion of thyroid function.
Absolutely. Like as you can tell, the list is extremely long and it's varied. So you might not be coming in thinking, oh, I want to test my thyroid. But if you come in and you have depression and infertility problems and problems with menstrual cycle, we're going to consider your thyroid as a possible, contributing factor into that. So even if, that list is very long, but no matter if you're presenting with any of those, then it's worth investigating the thyroid. Because information is good, right? Why would we not try to get as much information about what's going on for you?
Absolutely. Okay, so testing. What kind of testing should we be asking for? Like I said, most doctors are just running a TSH, which is thyroid stimulating hormone, and that is really looking at is your brain stimulating your thyroid. And that doesn't tell us a whole lot about what the thyroid is doing with that information. Exactly. So we highly encourage that patients ask for a full thyroid panel. So TSH, T3, T4, antibodies, and reverse T3. I forgot to say that when we were practicing, which is really critical.
Yes,
I think we'll do another post where we can talk about optimal ranges because I think it's so important, but we're trying to keep this not too overwhelming. But those are great tests to ask for from your medical doctor, or you can pay out of pocket with your naturopathic doctor, and we can really educate and empower you about what those values mean and what we're striving to achieve when we look at that when we look at those labs.
Yeah.
The other thing that I often will get my patients to do is get a glass thermometer. There's a certain technique with taking your body temperature, and we put those two pieces together, and then we really assess how your thyroid gland is influencing your overall health or the symptoms that you're currently experiencing.
Yeah. And just to try to give you a little bit more visualization, so I did hear a great analogy the other day. It's totally not mine, so if you're watching and it's yours, thank you. Just in terms of the thyroid hormones, that the brain talks to the thyroid gland, and the thyroid gland is kind of like the speaker that releases the music notes, or the T3 and T4, to the rest of the body. Okay, so if we're just looking at what's going on in that connection to the speaker, but we're not looking at what's going out to the rest of the body, it's not giving you a complete picture. All right?
Love it.
Moving
I
on.
like analogies. They're helpful.
Absolutely.
All right, so what are some things that you would do if we would talk about if you came into a naturopathic doctor's office and we talk about lifestyle and diet as possible interventions?
Absolutely.
One that's been well studied is going gluten-free, especially if there's autoimmune issues happening, so Graves' or Hashimoto's, and those antibodies are high. Going gluten-free, and for some people even grain-free, can be tremendously beneficial.
Yeah, absolutely. So what they're finding is that some of the proteins in gluten can kind of confuse the immune system. So kind of overloading the immune system, and it becomes kind of overactive and starts actually attacking things like the thyroid gland. So by removing the gluten, you remove that burden or that confusion, that layer of confusion from the body, and then the body is able to better process the hormones.
Yeah. Other avenues I'd like to explore is first challenging the thyroid gland. If we've identified that there's low thyroid function, I try and challenge my patients to see if we give the body everything that it needs, can it actually make T3 and T4?
Yeah.
So talking about supplementing iodine, selenium, zinc, and tyrosine, and sodium. A lot of people in my practice don't eat a processed food diet. They eat a whole foods diet. They're sodium deficient, and you need the sodium transport to bring that iodine that's so critical for thyroid function into the thyroid gland. So we talk about supplementing these minerals and to help support thyroid function. Other things that we can do are herbs. Oh, and food sources, sorry.
Yes.
Of iodine can be seaweeds. Selenium can be Brazil nuts.
2 Brazil nuts a day.
Yeah, 400 micrograms, I believe.
easy to do.
Yeah.
Almonds, avocados, those are sources of another amino acid called tyrosine, which is also another nutritional precursor for thyroid hormone. So like Dr. Michelle was saying, just making sure that in your diet, or even supplementing if need be, kind of giving the thyroid gland all of those baseline nutritional needs, if that's all it needs, you know, that little bump up to function optimally. But other things that we'll often use if needed beyond that are herbs. Botanical medicine offers us a lot of great options. So some herbs, if you've done any reading about thyroid function that you might have come across, are ashwagandha, which is just a beautiful herb, coleus, bladderwrack, or google. So all of those do kind of, you know, directly work with the thyroid hormone production system. Ashwagandha is nice as well because it also works on the stress balance system, which is where we're going next with this.
This is a big one. So, you know, stress plays a huge role here. Our cortisol, and cortisol being elevated, will have a direct blocking effect on your thyroid function. So we need to assess stress. We need to talk about it. We need to talk about how to manage it. And that needs to be under control to allow the thyroid to properly function. And I do see that in my practice where I feel like in all appearances, the thyroid really wants to perform, but stress is getting in the way from it doing that. And so sometimes we have to treat the adrenal glands to allow the thyroid to do
and I see that a lot, where by just like getting that stress response system under control and nourishing the adrenal glands, it provides the thyroid with the nourishment that it needs. So that's a huge piece when it comes to thyroid. So keep that in mind. It's not just about kind of diets and taking these other things. If you're constantly running in that fight or flight, that stress response system, it's going to continuously damage the thyroid function as well.
And the question that we originally asked, which is why we post this, and I'll let you continue, I won't jump in too much, but if you're stressed and you're trying to lose weight with low thyroid function, it's very difficult to do. So the cortisol needs to be assessed, because your body stays in fight or flight for too long, which sends different signals to your body to store fat instead of releasing it. So that is a huge obstacle when you have low thyroid function and you're really trying to lose weight. So you might need to take some meditation classes, which we're offering here next week. I'll talk about that at the end. Mindfulness or meditation at home, yoga, breathing, journaling, acupuncture. Dr. Lisa's amazing at that. She does a guided meditation as well, so very helpful for down regulating. If all of those are not quite getting where we need to go, or you have been on Synthroid and you want to talk about different, more natural options available to you, then desiccated thyroid or bioidentical hormones are something you may want to explore. I prescribe them here at the office. I really like to educate my patients about that. The results have been impressive and wonderful for people. So that is a definite viable option for people if they would like to explore that instead of an alternative to Synthroid, or as a more natural option with low thyroid function, and they just need a little bit more support than diet and lifestyle alone. Our toolbox has a lot of different tools in it. So keep that in mind, that, you know, if you have been struggling with thyroid issues for a long time and you've been going, you know, with medication and it's not quite working, we do have a lot of tools available to us. So the original question that was posted that prompted this was thyroid and weight loss, because inability to lose weight or weight gain is often a huge symptom that the thyroid's not functioning properly, even when you are medicated. So what I would say to that is, if you are struggling with that and you're working with your thyroid function, please make sure you are getting the full thyroid panel run. So not just that TSH, you really need to see what's going on with the T3, T4 as well, and monitor it regularly, because the thyroid is so sensitive. So as you do start to do new things, you know, it does shift. So monitor it regularly. Other things in terms of hypothyroidism and weight loss, it's actually discouraged to do a lot of calorie restriction.
So, and like yo-yo dieting, all of that stuff affects your metabolic set point. So making sure that you are eating enough of those whole, wholesome, good foods, which again we can talk about in another post, but I'm sure you know some of our food biases come out in almost every Facebook Live we do. If you haven't cut gluten out yet, try cutting gluten out of your diet as well. And something I always come across with thyroid and weight loss is, in terms of exercise, is obviously to exercise, but not over exercise, and that goes hand in hand with the calorie restriction as well. So just making sure that you are, you know, taking a really balanced approach to it, managing stress, all of those other cofactors that we talked about that also affect your thyroid health.
I'll quickly say, because I did want to say this, that body temperatures with a glass thermometer of consistently under 98 degrees Fahrenheit or 36.7 degrees Celsius would be considered low body temperature and needs to be addressed.
Yep.
So I quickly want to say that next Wednesday at 7 p.m. in the community space, we are hosting a 1-hour mindfulness meditation class. It's being taught by Shelly, who's wonderful. It's free. We just want people to get out, get to know her. Who doesn't need a little stress relief around the holidays? And learning those skills in a community-based setting is wonderful.
Yep.
Which is why we have the community space, is that we really want to help people reach their optimal health by learning new skills, and learning new skills with like-minded individuals is incredibly fun and inspiring and empowering, and it's awesome to watch. So we love it. So come join us. It will fill out for sure. So
yep,
I'll post that link too, so you can sign up.
Perfect.
Okay, that's it for today.
I think that's it today. A little bit of a heavier topic
today, less jovial, but maybe we'll be back next week. Well, we will be back next week, but maybe
we're not sure what we're talking about
yet,
to be honest.
Maybe it'll be fun. Maybe it'll be a little more health-oriented. Yeah. Suggestions are definitely encouraged, and we will post the new clinic page shortly. So follow us there, because come the new year, we're going to consistently do this.
Yes.
But we're going to do it over there.
Yeah.
Okay. You guys have a great day.
All right.
Thanks for listening.
Yep. Thanks for joining in. We'll see you next Thursday.
Yay.
Where's...
Oh.